Yeah, and I think it's a great space and a great environment. And I actually applaud all of you for being here, for being brave enough. I know that sounds funny, but a lot of people are too scared to come to Nimbin and learn about these things. And just by coming sitting on these red seats here and listening to some crazy hippies and some young doctors and some old doctors and some personal patient experiences, you learn a lot. And yeah, well done for making that first step, which is to educate yourself. And then the second step, if you're game, go and get some. If you want some help, come and see me and we'll work it out. And if it's a combination of legal, illegal, doesn't matter to me, it's all cannabis medicine. Yes, up the back.
In the invitation you just given about come and see you,
Yes.
I live in New Zealand, so you're in Queensland, obviously.
Yes.
So how, apart from an email, can I contact you?
Okay, yeah, good question. So how do you get in contact with me? Maybe sister can get my details back up, or they've all gone, but it's plantmed.net.au. You can Google us, or get the number and give us a phone call, just like a standard doctor's clinic. The girls will have a chat to you, my girls, and they'll put you in with myself or one of the other doctors, book you in. And we of course do in-clinic consultations in Brisbane, but we also do telehealth medicine, so we can do that via Skype or video phone in the initial consult. It's always nice to have at least a face. I do prefer to see people in person, but we do video consults and we can do that from the comfort of your home. And you can connect on your phone or your computer. And we also have a few areas where we have what's called satellite clinics. So we've got a couple of areas where we've got basically a direct video link to our doctors. And we have them in some pharmacies, and maybe we'll talk about putting one in Nimbin, I don't know. But it's something where you can talk from a distance to our doctors and they can continue your care from a distance. If you can make it to Brisbane, we always love to see people in person. But we can do that via video medicine. And as I said, I have patients as far as Tasmania and the Northern Territory. One more question over here.
So, I've been on a journey with my doctor for a couple of years because I've been on the black market products.
Mm-hmm.
It's taken 2 years for him. He keeps agreeing that cannabis is helping me. He wouldn't write me the script until I mentioned that I'm going to go somewhere else and get the script. But he's becoming, he's like, oh, I can actually do that. He doesn't know anything about it.
Yep.
Where would he go? How can I've taken him books and this.
Yeah. Well, a great resource, unfortunately at the moment, and I'm trying to rectify all this by putting together a body called the Australian College of Cannabis Clinicians, and we're going to be focusing on education. That's still coming up and coming. But what you can do is go to a site called the AustralianCannabisSummit.com. Is it with a "the", Christian? Or? AustralianCannabisSummit.com. And that's an event we put on last year, which has got lots of educational videos. There's another doctor, Teresa Taupik, and she has a group called Medijuana, so it's Medijuana, as in marijuana, Medijuana, and they do online courses for doctors. But unfortunately at this point it is still very much a self-education thing for doctors. And that's correct, anyone can prescribe. If you're a doctor, you technically can fill out the form and get that medicine. But I do feel there is a lot more to it than just getting the form through. And having that knowledge about how to use the medicines is important, and what ratios and how much and when. Exactly. Exactly. That's often the case. And look, if you know what you want and you just want to get it legally and he can help you do those forms, do that. Otherwise, if you have a doctor that is keen but not very knowledgeable, get them to write a referral letter to see someone like us, okay? And they can sort of pass that off and we'll communicate back and forth to them. And then what happens is they slowly get educated. Because as they send more patients, I write them more letters back saying, we've given this lady a 1:1 at 15 milligrams in the morning and 15 in the evening. And we've given this child a CBD high medication 3 times a day at 80 milligrams a time. And they start to learn what the rough dosing is, and they start to realise, oh look, my last 5 patients which I sent there have had no problems. they're getting off their medications, they're feeling better. Seems pretty simple, I'll give it a go. And so they'll learn, and I'm seeing people change. We have referring doctors who referred under duress from their patients after being hassled. Oh, bloody hell, here's your thing, get out of my face. You know? And then 6 months down the track, I get regular referrals from those people. And they're like, they realise that it's just like sending someone to an orthopaedic surgeon for a broken bone. You send someone to a cannabis specialist for specialist cannabis treatment. It's not saying you can't do it yourself. You know, most things with pain, a couple of sprays of a 1:1, you're probably going to be fine. But if it's a more complicated case, then it is good to have some experience there. Not myself personally. To get Medicare rebates, you have to be a GP, and I never became a GP. I was doing other things in my medical career before this. So as a GP, you can get the medical rebate. That'll be about $38. But the time it takes and the admin and everything and the costs of running these things, it's impossible to do. In my opinion, it's impossible to run a good cannabis consult in the 15 minutes allowed in a GP office. It's not going to happen, and that's the reason a lot of GPs will just refer, because they haven't got time. They've got their whole day's 15-minute slots, whereas our initial consult's 1 hour. We always put an hour aside for that initial consult, and I won't stop talking. I won't finish that consult till when I say, do you have any questions? And you say, no. Okay? That's the difference. That's the difference, yeah. Raynaud's, Raynauds.
Isn't he a good talker? I don't know, what is it? He just keeps it simple and sane and intelligent and easy to understand. Anyway, I hope he's going to come and talk at Mardi Gras this year for the first time. Really appreciate you coming today. Thanks heaps.
Thank you.